Hey everybody, I am Josh along with Peter,
Hello.
and we are giving a presentation on our very low calorie diet, safe to use with patients who have non alcoholic fatty liver disease, a scoping review. Since this presentation is about a paper we are currently working on, we decided to include all of our fellow authors, who are lovely people, and include our affiliations, which are the University of Iowa, Iowa Biosciences Academy, or IBA, and, of course, ICRU. Here's our background. NAFLD, or non-alcoholic fatty liver disease, is a condition of fat infiltration into the liver that is associated with obesity. This fat infiltration may be reversed. NASH, or non-alcoholic steatohepatitis, is a form of NAFLD in which there is inflammation affecting the liver function and can cause serious problems such as fibrosis and cirrhosis, which are forms of scarring of the tissue and may lead to cancer. The prevalence of liver disease in the United States is on the rise and seems to be correlated with obesity. In fact, NASH has surpassed hepatitis C as one of the leading indications for liver transplant. The current solution for chronic liver disease is often a liver transplant. However, the solution has its own issue, and that issue is that a person cannot receive a liver transplant surgery if they have too large of a BMI, which means that these patients that have a liver disease that is probably caused because of their obesity, but they cannot have a liver transplant surgery to help fix the liver disease because of said obesity. This is a big problem. And then our objectives for the paper. Objective 1 was to map out the existing research on the use of very low calorie diets in both liver transplant candidates and those with chronic liver disease. And second, to examine the safety of very low calorie diets in patients with liver disease.
So we have here, these are the inclusion and exclusion criteria we use for the screening process. In the inclusion criteria, we have adults that are older than 18 years old with obesity and liver disease. And the article must report weight loss and safety concerns, and also must include very low calorie diet, which is defined by less than 900 calories per day. In the exclusion criteria, we have patients that's less than 18 years old, pregnant women, or any patients with acute medical illness or terminally ill. So this is a flowchart that we followed for our screening process. We started with 2,712 articles from 4 different databases. And after removing duplicates and articles that don't fit into the inclusion criteria, we arrived at a total of 10 articles. And of the 10 articles included, there were 3 randomized trials, 5 cohort studies, 1 case control study, and 1 case series. 9 out of the 10 papers focused on NAFLD and NASH, and 1 was focused on ESLD, which is end-stage liver disease, also known as decompensated cirrhosis of the liver. And like the name suggests, it is a badly damaged liver that requires transplantation. So here's a table of our findings of the data we extracted from each paper. We looked at the intervention, the clinical outcomes, liver disease and weight loss outcomes, and finally, the safety concerns. We will present this table later on if you guys want to take a closer look. So what we found is that very low calorie diets is very effective at creating weight loss in patients that strictly follow the regime. The weight loss varies per study due to the duration of the diet and the restricted caloric intake. For example, in one study by Lin, they found that the patients in the 800 calories per day group lost an average of 8.9% of their body weight after a 12-week period. One major benefit of the weight loss is so that the patient can be eligible for liver transplantation, as Josh described, because the surgery has a minimum requirement of BMI that's less than 40, according to the AASLD guidelines, which is the American Association for the Study of Liver Disease. And another benefit includes a reduction of liver fat and volume, and in many cases, reversion of NAFLD and NASH. This was also seen in a study by Lin, where 16% of the patients initially identified as NAFLD returned to normal liver function by the end of 12 weeks, or the Temmerman case series, where patient 1 was actually taken off the liver transplant list, and patient 2 had a stable MELD score after very low calorie diet. And MELD score is a scoring system used to define the severity of the disease, of liver disease. And lastly, there were no severe adverse events reported in any of the studies. But the fact is that most of the studies are done in short durations of up to 16 weeks, so not enough information can be given for long-term effects.
Our conclusion is that very low calorie diet seems to be effective in reducing the BMI of patients with liver disease, which may help them be able to get a life-saving liver transplant, or may even be able to reverse some of the liver disease to where a liver transplant is not needed. These studies show that a very low calorie diet has a relatively high adherence rate. However, the longer the diet lasts, it is expected to decrease, and the diet seems to have no major safety outcome concerns. Lastly, all of the studies included in the scoping review had some key differences in the type of diet, duration of diet, and the liver disease outcome measurements. Future directions that we have looked into. So there's a general need for abundant research in this topic. We only got 10 papers out of 2,700-ish. We wanted to explore the differences in variables like changing how many kilocalories per day and the duration of the test, and a standardized method of approach for the use of a very low calorie diet in this patient population. And then finally, a link between very low calorie diet and liver disease outcomes. That's it. Any questions? And here is that lovely table again.
Thank you.
Thank you.